Hello, everyone. This is Sherry with the CGH Health Foundation, and welcome to our Growing Healthier program for August. This is an educational series. It's sponsored by the CGH Health Foundation, and we try to educate you about important health topics and services that we have at CGH, and it also gives us the opportunity to introduce you to some of our very knowledgeable health professionals. Our programs are hosted by Dr. Bill Bird, our Chief Medical Officer at CGH. I know a lot of you have been looking forward to today's program. Dr. Bird's guests today are CGH orthopedic surgeons, Dr. Sean Hanlon and Dr. Jeffrey Thormeyer, and they have been performing hip and knee replacements with the new Mako SmartRobotics system. We're the only hospital in the area to offer this technology, and it helps our surgeons give our patients a better outcome. I think you'll really enjoy their program today. Next month, our program, and actually just a couple of weeks from today, is on Thursday, September 5th. And Dr. Bird is going to be talking to Dr. Destiny DeLemos, who is our new CGH Emergency Department Director. The program is called Building Better Emergency Care, and Dr. Bird and Dr. DeLemos are going to be talking about the ways that CGH is improving the delivery of emergency care to our patients. So put that one on your calendar for Thursday, September 5th at noon here on Facebook Live. And speaking of putting things on your calendar, the CGH Health Foundation, we're in the process of planning our Fall Delicious Designs auction event. Our auction features lots of beautiful baskets and desserts, and the proceeds help to fund our programs for women's health, oncology, and dementia services. It's a virtual auction. The bidding starts on Thursday, October 17th, and goes through the end of the day on Tuesday, October 22nd. And we're doing something a little new this year. We're going to have a live preview of the auction items. We're calling it our Shopatizer, and that's going to be on Wednesday, October 16th from 4 to 6 in the afternoon here in the foundation offices. So you'll be able to view the baskets. We'll have snacks and desserts and appetizers for you, and you might be able to win surprises too. So it's going to be a totally hip, and you really need to be there. And Dr. Bird, how do you like the way I segued into your program?
Sherry, you're the best. Welcome, everybody. Thanks, Sherry. This is Bill Bird, Chief Medical Officer at CGH Medical Center. And yes, I'm really looking forward today to talking with Dr. Sean Hanlon and Dr. Jeff Thormeyer about this new robotic surgery that they're doing for knee and hip replacements. So without further ado, let's get Dr. Hanlon and Dr. Thormeyer on the screen with me. Hi, Dr. Hanlon. Hi, Dr. Thormeyer. Welcome.
Bird. Thanks for having us.
Yeah, we're glad we could get you on this month. Pretty cool stuff we're going to talk about today. But before we get to talking specifically about robotic surgery, I just want to ask you, the both of you, just some more general questions regarding joint replacements and those type of items. So the first thing's this. I don't know, maybe I'm wrong on this, but it seems since I started practicing medicine that the number of knee and hip replacement surgeries that patients are having has gone up. Am I correct on that? And if wrong, okay, but if I'm correct on that, what do you think is contributing to that?
It definitely is increasing in number. I think there are going to be there over 1 million joint replacements done yearly in this country now. And some of that is the fact that our average age, our population is aging. And as patients age, their joints deteriorate and arthritis becomes a bigger issue. But a big part of that also is that younger patients are wanting this type of surgery to maintain an active lifestyle. Young folks don't want to settle for a more sedentary lifestyle, and so they want to continue to do the things they enjoy. And if they're being limited by their painful joint, they're opting at younger and younger age to do it.
Yeah. Anything else to add to that, Jeff?
Yeah, I think the strong track record of people responding to this type of procedure, coupled with better techniques, better equipment, longer lasting implants, have all, pushed towards doing it, and like Sean mentioned, in younger folks as well.
Okay. So people, if they can, want to not have joint replacement surgery. So can you just mention to the folks who are listening, what are some options that you have for patients and you offer patients before they get to the point where they're going to need a joint replacement?
So I think, and again, it's different amongst providers, but a hallmark of treatment usually involves anti-inflammatories, consideration of injections of steroid, and in the knee there is a lubricant type injection that we can utilize. Healthier lifestyle encouragement, weight loss. I mean, across the board, with almost every study over years that we've done, weight loss is always on the, is a positive sort of variable in terms of outcomes and improvements. We certainly start there.
Okay. Anything else to add to that, Sean?
Physical therapy can help, introducing some exercises to strengthen the muscles around the joint and improve flexibility. That can be of value. I think Jeff's point about weight loss is key. That can help the patient in the here and now. It can improve their overall health. And if ultimately they are a candidate for knee or hip replacement, their complication risk is going to be lower if they can lose weight. So I think it's a win-win there as well.
Okay. What are the indications for, and who are good candidates for hip and knee replacement surgery?
It's a patient who has a painful hip or knee as a result of arthritis. Arthritis can be osteoarthritis is the most common cause, but rheumatoid arthritis is also seen as a cause for joint deterioration and arthritis, and then post-traumatic arthritis, the arthritis that comes after an injury to the joint in the past. So if the patient has that, and if they have failed non-surgical treatments that we mentioned earlier, and if they have a good understanding of the operation and the risks involved, and they have a acceptable medical package. In other words, if their medical conditions are well controlled, diabetes, for instance, or heart disease, if these are well controlled and they pass a physical examination by their primary provider, then they can be a candidate for the joint replacement.
Anything to add to that, Jeff?
The discussion needs to be had in terms of the recovery process and the rehab, which is very important afterward. This is not just a simple procedure with replacement of parts with metal and plastic and you're good. I mean, it's going to require some exercise and some due diligence by the patient to have a better outcome as well.
Okay. We're going to get into a little bit of the imaging that patients need to have if they're going to have robotic surgery. So I don't want to touch on that quite yet. But other than that, when the decision is made between yourselves and the patient that it's okay, it's time to proceed to this surgery, what steps do the patients have to take prior to going forward with surgery?
They have to be scheduled for a primary care visit for a physical examination by their primary care provider. They might need consultation with specialists such as a cardiologist if they have underlying heart disease, to have the cardiologist evaluate their condition to make sure they're safe to undergo the operation. There's laboratory work that needs to be done and blood work. There's chest X-ray, EKG, and they will have had already an X-ray of the joint that we're going to be working on as part of their initial office visit. But then for the robotic joint replacements, they also need a three-dimensional CT scan, which is ordered within a couple of weeks of the date of the surgery. And that's the study that we use with the Mako technology to actually plan the operation.
Okay. Do you have your patients go to rehab, to physical therapy before they have surgery?
But not the not just there's an introduction to what's going to be done afterwards after surgery. There's also some things that can be discussed sort of leading into surgery, things that patients can work on that can optimize again their outcome, make things a little easier afterwards. And then the last thing I guess to touch on is there's often an evaluation of the home situation in terms of post-operatively, are there any hindrances at home, safety issues? Because folks, obviously, it's going to be a while before folks are moving around
Yeah, that makes
sort of in a
sense.
normal. So, and just get a feeling for the support system immediately after surgery as well.
Yeah. Okay, great. Okay, so we're going to do now is, before we talk about actually the robotic surgery, Dr. Hanlon and Thormeyer had a couple of videos they thought would be really helpful for you all to see. So this is our first ever attempt to live stream videos for Facebook Live. So we have our fingers fingers crossed. And if you would, you're going to see two short videos. So I'm going to hand it over to our marketing team to try to make that happen.
Our knees are the largest joints in our bodies. They're central to almost everything we do. So if you or a loved one is suffering from arthritis or an injury to the knee, everyday activities such as walking, sitting, or kneeling can feel debilitating. But you're not alone. It's one of the nation's most common causes of disability and impacts the lives of 54 million people in the United States alone. One possible treatment option for knee pain is total knee replacement, a procedure that involves removing the damaged bone and cartilage, then replacing the knee joint with an implant to reduce pain and restore the motion and function of the knee. Today, knee replacement surgeries are being combined with a new technology, and it's changing the way knee pain sufferers are treated. Meet Mako, a robotic arm-assisted technology used by surgeons to perform total knee replacements. This unique technology helps surgeons provide a personalized surgical experience, where each surgical plan is based on a patient-specific diagnosis and anatomy. And in a laboratory study, Mako Total Knee enabled surgeons to execute their plans more accurately, while also protecting soft tissue and ligaments from damage. Let's take a look at how it works. It begins with a CT scan of the knee joint. A CT scan is a series of X-rays taken at different angles that can help surgeons see things that they can't typically see with an X-ray alone. The CT scan data is used to generate a 3D virtual model of the patient's unique anatomy. This virtual model is loaded into the Mako system software and is used to create the personalized preoperative plan. Prior to surgery, the surgeon reviews the plan size and placement of the implant, and if necessary, modifies the preoperative plan in order to better position the implant to the patient's unique anatomy. During surgery, the surgeon locates points on the knee in order to register the anatomy in the Mako system. This process establishes the relationship between the patient's actual anatomy in the operating room and the 3D model that was used during the planning process. This step helps ensure the procedure is executed to plan. Once the anatomy is registered to the 3D model, the surgeon has the flexibility to modify the preoperative plan based on their assessment of the patient's anatomy and range of motion. Then, the surgeon guides the robotic arm to remove the arthritic bone and cartilage from the knee. A virtual boundary provides tactile resistance to prevent the surgeon from removing more than just the arthritic bone identified in the preoperative plan. And visual cues, shown in green, appear on screen to show how much bone to remove. Collectively, these cues help the surgeon stay on the preoperative surgical plan. With the diseased bone gone, a knee implant is inserted into the joint space. And once the surgeon is comfortable with the knee's movement, it's off to the recovery room to begin the journey towards strengthening the knee joint. For more than 100 years, joint replacement surgery has been used to treat patients with chronic hip pain. Today, These surgical techniques are being combined with a new technology, and it's changing the way joint pain sufferers receive care. Meet Mako, a robotic arm-assisted technology used by surgeons to perform total hip replacements. This unique technology helps surgeons provide a personalized surgical experience where each surgical plan is based on a patient-specific diagnosis and anatomy. Here's how it works. It begins with a CAT scan or CT scan of the hip joint. A CT scan is a series of X-rays taken at different angles that can help surgeons see things that they can't typically see with an X-ray alone. The CT scan data is used to generate a 3D virtual model of the patient's unique anatomy. This virtual model is loaded into the Mako system software and is used to create a personalized preoperative plan. Prior to surgery, the surgeon reviews the plan size and placement of the implant. If necessary, the surgeon modifies the preoperative plan to help control important measures of hip stability. During surgery, the surgeon locates points on the hip in order to register the anatomy in the Mako system. This process establishes the relationship between the patient's actual anatomy in the operating room and the 3D model that was used during the planning process. This step helps ensure the procedure is executed to plan. Once the anatomy is registered to the 3D model, the surgeon has the flexibility to modify the preoperative plan based on their assessment of the patient's anatomy. Then, the surgeon guides the robotic arm to remove the arthritic bone and cartilage from the hip. A virtual boundary provides tactile resistance to prevent the surgeon from removing more than just the arthritic bone identified in the preoperative plan. And visual cues, shown in green, appear on screen to show how much bone to remove. Collectively, this helps provide more accurate placement of the implant to the surgeon's preoperative plan. Mako assists the surgeon in performing controlled and accurate preparation of the hip socket. As the surgeon prepares to place the implant into its final position, the robotic arm guides the cup at the desired angle defined in the surgical plan. With the diseased bone gone, a total hip implant is inserted in the joint space. And that's how Mako Total Hip is transforming joint replacement.
Well, that is very cool stuff. I'm sure you guys are having a good time with that.
It's actually great fun. It's a unbelievable technology. I think Jeff would agree with me. It makes us better at doing the surgery. I've done them for a long time manually in the standard fashion, and I really thought we were doing very good work with good outcomes. And I question why we should consider this, but having gone through the training and now doing these, I'm convinced it makes us better at doing the operations than we were able to do before.
Well, that's really great to hear. In what way would you say, for both of you, in what way do you feel like it makes the surgery better for you and for the patients?
I certainly have a lot more confidence in terms of placement of implants. I think some of the ways of doing it before we had the access to the robot, there was some things that you couldn't control, and there was some things that you thought you had placed in a certain position, and then when you get post-op X-rays, you realize, well, that's not really where I thought I had put it. And that's been, especially in hips, that's been a big issue, is sort of placement of the cup. And there's factors, patient position, movement, and just alterations in anatomy and visualization. There's a lot of things that went into that. And I think with this now, there's a pre-op planning part of it, but what's very helpful is the intra-op, and getting a sense for, there's all these checks that you can do during surgery, and you're not relying so much on, your eyes per se, or, your gut. You're getting all the data sort of live during the procedure. And I think you walk away with a lot more confidence that, that we've executed the plan more efficiently and more specifically.
I think we can be more precise in how we cut the bone to achieve the alignment of the joint. In a knee, for instance, proper alignment is very important, and proper ligament balance is very important. And again, although I think we were very good at doing that in the past, I think this technology makes us better. We can get more consistent balance of ligaments, more consistent alignment of the limb. In the hip, we can get more consistent positioning of the components. I think there is less soft tissue injury as a result of using the robot, because instead of balancing the knee with soft tissue releases, which involve more trauma to the tissue around the knee in particular, we get that balance with the bone cuts as a result of the plan that we set based off of the CT scan. So I think there are many ways that it's better, but these are the things that I've learned as we've gone on to do this now that make the operation better, safer. There's less trauma to the joint.
Have you guys seen any difference in terms of the patients post-operatively, but whether that be in the hospital or their rehab process, or when they come back to see you in the office, in terms of how they do?
I think the operation is the operation. It's still a big surgery, and I think we've seen some improvement in their post-operative recovery, but it's not a huge jump forward in that. It's still big surgery. It requires physical therapy. It requires a recovery, and so this doesn't make it a great deal easier to go through the post-operative period. But I've seen some improvements in that regard. Jeff?
I agree. I think, given the fact that we've only had it for a few months and we don't really have any personal long-term sort of data yet, but I think we've seen some slight improvements in certain variables. But I completely agree. The patient experience essentially is very similar to how it was before in terms of the incision and just the expected things that they're going to deal with in terms of recovery.
So the length of stay, some of these evaluations of like what their home's like and how much, whether they'll be able to go straight home after they're discharged from the hospital, that still stays the same.
Yes.
Yes.
Okay. All right. And I wanted folks to, Sherry touched on this, but I just want to make sure that folks can hear this from you all. Like, from your perspective, for a community hospital, how common is it to have something like this in place to be able to do this robotic surgery?
I think we're the only hospital in our region that has one. I think it's growing. The robot's been around. This Mako robot's been around since 2017, and we were considering it right around the time that COVID came, and now we've gone with it now. But I think it will become increasingly more common. Our patients know about it. Some patients in the past have left town to have their joint replacements done because they wanted to have it done robotically. But for a small community hospital, I think we're probably, there's only a small percentage of small community hospitals that have this technology available now. And so I'm really glad we can offer that to the patients. There are tertiary centers that aren't using robotic surgery yet. So I think that, there's a increasing emphasis on it, but and we'll see it more and more. But I'm glad we're doing it now and offering it to our community now.
Anything to add to that, Jeff?
Well, and just to sort of add on top of it, I think what's also exciting is, there's potential to sort of broaden the purpose of this to shoulders potentially in the next year or so as well. So having that on board, I think.
I wondered if you would bring that up, because you're our shoulder guy. So yeah.
Yeah. So I every time I'm talking to the reps, I'm asking about where that is, because it's certainly like well into the process, and the hope is that maybe within the next year that's going to be added to the armamentarium here.
Okay. Yeah, that would be really cool too. Yeah. Tom wanted to know, does excessive BMI impact the use of the robot or the long-term outcome for the prosthetics?
Yeah, the BMI is important. Studies.
And by the way, let's just define that for what that BMI stands for, if you would, Sean.
Body mass index is a number that is a ratio of height and weight. So a taller person at the same weight would have a lower BMI than a shorter person at that weight. So BMI is the number that we look at, and BMI of 40 is kind of like the golden cutoff that we look at. A lot of studies have shown higher risk of complications after surgery in patients whose BMI is over 40. Robotic surgery, I think, makes doing this operation on a patient with a higher BMI easier. It makes the operation better in a patient with a higher BMI. So I think this is going to be a big plus for us, for the doctors who have to do this, who are doing this surgery, to be able to offer this operation to patients with higher BMI. That being said, we still encourage our patients whose BMI is over 40 to get that number down below 40 before surgery to reduce their complication risk. So it's one aspect of this is the ease of surgery. It'll be easier with the robot to do a patient with higher BMI. But the other aspect is their complication risk. The robot doesn't change that. And so we still want our patients to work on weight loss prior to surgery if we feel that's important. Long-term outcome, it's like any other mechanical machine. This joint is going to last longer, and it's going to be in service longer if the wear and tear is lower, and the wear and tear will be lower at a lower BMI.
Anything to add to that, Jeff?
No, I was just going to add that caveat about, while it may make it easier for us with folks that have higher BMIs, it has not changed essentially that number of 40 in terms of the comfort level, in terms of risks from having just the surgery itself. So we got to be careful about sort of how we state that. We're still going to do everything we can to encourage folks to lose weight, because outcomes have been better regardless of robotic use or not, below a certain point.
Yeah. But I do hear some hope in that. Thanks, Tom, for the question. I do hear some hope in that, though, because it seems like it does become a vicious circle for folks whose BMI is really high, is they have arthritis and they have high BMI, and you want them to move around and you tell them to move around, but it's even harder to move around, and it just kind of gets harder and harder because you have all this weight, and then you have this arthritis. And now there's the potential for some of those folks to have the surgery done, and maybe they don't have as much pain, and maybe they can begin to move more and then begin to lose some weight. So I know that won't work for everyone, but for some patients, I hear that and think, well, that could be helpful for them.
Oh, it's definitely an incentive. If a patient is suffering with a painful knee or hip, and we have a conversation about that, and we provide helps that we can offer here at the hospital, I've seen this be the difference maker for patients in their effort to lose weight. And something they may have struggled with for years and years, but once they know that, hey, there's hope for this knee or this hip pain that I have, if I can just get the weight off, it's another incentive for them to get there.
Does the surgery last any different in terms of time-wise with doing robotic surgery versus conventional?
The time, I mean, at the time of the procedure itself.
Yeah.
I mean, there's some additional steps. It doesn't add a lot of time, and what's been shown is essentially the more you do, and as more the team gets comfortable with those new steps, it doesn't significantly add a lot of time to it. So it's just like anything else when you're learning something new. It's you go a little bit slower until you get a little more comfortable.
Yeah, that makes sense. I wanted to talk about a couple of things. Anything else you guys wanted to say about the robotic piece of this and this robotic surgery for patients?
I'm really enthusiastic about it. I think it's a big step forward for us and for our patients. I'm not a technology guy at my age, and I really never thought that I would adopt this. But now that we've got it, I love it. It's better. I'm going to do all my knee replacements that way, and I'm going to be doing. Dr. Thormeyer has already started doing hip replacements with the robot, and I'll be following him as well. So I think this is something that's going to be here to stay, and it's going to improve the joint replacement surgery that we offer our patients here.
Anything else to add to that, Jeff?
I mean, I second that for sure. I think that it opens up a lot of avenues for us in terms of, there's certain folks that have real complicated anatomy, whether that's just what they have or post-traumatic. And I think that the technology, potentially allows us to, treat some folks that we may not have treated in the past, just from a capability and confidence, level. And then again, with the emerging technology, to other joints, I think this is going to be, just real groundbreaking for us.
Yeah, I'm really excited about it. I did want to touch on one other thing, just in terms of patients and their experience at CGH when they're having surgery, and that's regarding their pain and their post-operative pain. Can you guys just talk a little bit about what we're doing here at this community hospital in terms of regional nerve blocks and how that's helping patients too?
Our anesthesia department is I will say that our anesthesia department, it's the best we've ever had, and all of the doctors and registered nurse anesthetists that we have here are very skilled at doing regional nerve block anesthesia. And so prior to surgery, each patient receives a regional nerve block before they go into the operating room, either for the hip or the knee. This provides pain relief and anesthesia during the operation, and it also provides a lasting benefit after the surgery for pain control in the days following the surgery. And a patient can get improved pain control for up to several days following the operation from these regional nerve blocks. So it's an important aspect. It allows us to get the patients home sooner. We keep our patients one night in the hospital, but it's conceivable that we will be able to allow some patients perhaps to go home same day with their pain under better control. That's not currently our pattern here. We normally keep patients one night at least, but it's conceivable with the regional anesthesia that we have available for patients to go home same day ultimately.
Yeah, thanks for sharing that, Sean. And I just want to bring that up because I think our community hospital does a fabulous job of providing services for patients that not every community hospital does. And this robot is a game changer. And in a similar way, I think this regional nerve block that we're able to do here is very helpful for patients as well, that I don't think every community hospital would have available for them. So just wanted to highlight that also. Guys, it's been great having you, and great having you here at CGH, first of all, but just having you on Facebook Live with me today. And yeah, there's a phone number if you have any more questions about that. And I know both Dr. Hanlon and Dr. Thormeyer are taking on patients who are interested in meeting with them and talking about having this surgery performed. So Dr. Hanlon, Dr. Thormeyer, thank you for all you do, and thank you for spending some time with us today here on Facebook Live.
Thanks, Bill.
Yeah, and also Dr. Thormeyer is actually on active duty right now in the Guard. So Jeff, as the girls are saying here, thanks for your service. Appreciate what you're doing.
Good talking to you guys.
All right. Take care.
Thank you.
Okay, I have some shout outs I want to give here before we sign off. So first of all, I want to congratulate Jose Sandoval. Jose is our employee of the month. For the month of August, Jose works out in our warehouse where they get all the supplies that we need for the hospital to function the way that it does. So thanks to Jose, and congratulations to Jose. And also congratulations to one of our rehabilitation occupational therapists, Bree Hamstra, recently received a CGH Hero Award for saving the life of a patient in our rehab department parking lot who had a concealed carry gun and accidentally discharged that gun in their car. And Bree and the police chief to her right in that picture were able literally to save the life of this patient to Bree's left there in that picture. So quite the story, and congratulations and thanks to Bree, and also to the fire chief, I don't know his name off the top of my head, who was involved in helping that patient out. Okay, and just as the highlight, ReadyCare is now, we have ReadyCare now both in Sterling and Dixon that are open, same hours, same services, look alike, sound alike, they are alike, for patients to be able to go and seek care for those conditions that they need to be taken care of on an urgent basis. I want to highlight next month, which actually is going to be in a couple of weeks, we're going to be talking to Dr. DeLemos about building better emergency care. So looking forward to the conversation with Dr. Lemos and what we can help to educate you about what's going on in our ED. Well, thanks for taking the time to watch this program. If you think it was helpful, please feel free to share it with others. Until next month, thanks for watching in. This is Bill Bird, Chief Medical Officer at CGH Medical Center.